Wash my hands. Hello, my name is Nicole. I'll be your nurse practitioner today doing your interview as well as your head, eyes, ears, nose, throat exam and range of motion exam. Do you have any questions before we get started?
No.
Very good. So the first thing I'm going to do is we're just going to do a general inspection. So we're looking as a whole to see if there's any rashes, any swelling, any deformities, anything that's standing out immediately, and I do not see anything. Is it okay if I touch you?
Please.
Okay, so then we're just going to check the skin. We're feeling for texture, warmth, or temperature, and we're going to check for turgor by doing a skin tent test, I'm also going to look at circulation of the fingers, so I'm looking for any abnormality of the fingernails to include clubbing, and I'm looking at circulation by doing a cap refill, and everything looks good there. So I'm going to start at the top. So we're going to look at the head. We're looking to ensure that there's even hair distribution. We're looking to see if there's any lumps, bumps, wounds that should not be there. And I'm not seeing anything right now. Very good. Can you go ahead and look forward for me? We're then going to move to the eyes. So we're checking the eyebrows to make sure the hair is evenly distributed there. We're also looking at the eyelids. We're looking around the eyes to look for edema, redness, any drainage, any wounds. And so far there, everything looks okay. I'm gonna lift the eyelids up. I'm looking at the sclera. And I'm look up for me. Very good. And the conjunctiva to make sure everything looks good and there's no redness. We're also checking the lacrimal glands right in here. Well, in here, I'm going to be feeling around, just gentle pressure around the orbital bones. And those feel okay. Are you having any pain?
No.
Very good. I'm also going to look externally at the nose. We are checking for symmetry. We're checking for color, texture. We're checking for anything that shouldn't be there or even normal findings such as moles. I don't see anything right now. I'm going to tip your head up a little bit, and I'm going to lift the bridge of your nose so I can look inside your nose or inside your nares, and I'm looking at the nasal mucosa to make sure that it is nice and moist and pink and it looks good. I'm looking at the turbinates to ensure that those are good and patent, which they are, and I'm also looking at the septum to make sure there's no deviation there, and that looks okay. I'm also just making sure that there is no drainage or foreign bodies in the nose, and that looks, as I said, okay. I'm going to look externally at the ears. When I'm looking at the ears, we are looking for swelling, we're looking for foreign bodies, we're looking for drainage, redness, any change in temperature, and that looks fine. Okay, we're all going to check the mouth. We're checking externally first. We're looking for all of the same things, so we're looking for dryness, any cracks, any wounds, symmetry, and everything looks good there. So I'm going to have you open your mouth and you stick your tongue out and say ah. Very good. You can relax for a moment. We're looking at the posterior of the throat to make sure everything looks good there, to make sure it's pink and moist, no redness, no cobblestoning. We're also looking at the tonsils to ensure that the oral airway is patent and they're not edematous, or there's no exudate in place, and everything again looks fine. I'm going to now check for oral mucosa, so I'm going to look at the buccal areas. So if you could open your mouth for me. I'm going to have you move your tongue to the left for me. Very good. Move your tongue to the right and lift your tongue up to the roof of your mouth. Very good. And everything looks good there. So we're checking also gums and dentation when we're looking in the oral cavity. And everything looks good there. So now I'm going to come up here. I am going to check your sinuses. So we're checking just the frontal sinuses with some gentle pressure. We're also looking at the ethmoid sinuses and the maxillary sinuses. Any pain?
No.
Very good. I'm going to check your temporal artery. Okay. And no bounding. I'm not feeling anything abnormal there. So now we're just going to listen to make sure. And we're listening to see if we hear any bruits. And that sounds good. Nothing noted. And again, that sounds good. No bruit noted. Okay, I'm gonna go ahead and check the lymph nodes. We're gonna start with preauricular lymph nodes. We're gonna work down to the postauricular lymph nodes, the submandibular lymph nodes, as well as the submental lymph nodes. We're gonna go ahead and check the anterior cervical lymph nodes, as well as the posterior cervical lymph nodes. I'm gonna check the supraclavicular lymph nodes and intraclavicular lymph nodes. And that feels good. I don't feel anything abnormal. Were you having any pain?
No.
Very good. I'm also going to be checking for jugular vein distension. I don't see any on this, the left side. We're going to check the right side as well. Very good. I'm also going to listen to see if we hear any bruits in the jugular area. Very good. No bruise noted on either side. I'm going to check the thyroid, so I'm going to sit right next to you. I'm going to kind of sit behind you a little bit. I'm going to feel both sides of the thyroid just to make sure I'm not feeling any nodules there or anything that shouldn't be there, and everything feels fine. And have you go ahead and swallow for me. Very good. And that glides over very easily. Okay. Now we are going to go ahead and move to the range of motion portion of this exam. I'm going to take the stethoscope off. Are you okay with standing for a moment?
Yes.
Please stand. Okay, so I'm going to have you look towards the window. Upon standing, we are doing a general inspection. We're looking at the skin again. We're looking for any abnormal structures. We're looking for any rashes, moles. We're checking temperature as well as texture of the skin. And to include turgor. Okay, so I'm just going to palpate down the spine, making sure that's good in an alignment. I'm also looking for things like lordosis or kyphosis in the back, which is abnormal curvature of the spine, which I don't see any. Okay, we're gonna start with flexion. I'm gonna have you touch your hands to your toes if you can. Just bend over. Very good. As he's bending over, I am going to check the alignment again of the spine just to make sure there's no abnormal curvature such as scoliosis. Okay, you can stand for me. Very good. Now we're going to be looking at extension of your back. So I'm going to have you just put your hands on your hips. I'm going to have you slowly go back for me. Very good. Okay, you can relax. You can face me. Okay, now we're going to look at lateral motion of your spine. So I'm going to have you just go over to your left side. Very good. And then over to your right side. So good lateral motion as well. And if you can rotate, I'm going to have you rotate your spine around. Very good. Okay, you can relax. While you're standing, we'll just go ahead and do your shoulders since it's a little easier. So one, I'm going to have you shrug your shoulders for me. Good. And then go ahead and resist me pressing down. Very good. Good strength in your shoulders as well. I'm going to have you move your arms like me, and we're checking for adduction of your shoulders. So let's start with the left. So adduction, and then abduction. You're going to bring it back in. Very good. We're going to do internal rotation forward. Very good. External rotation backwards. Very good. Same thing over here. So we're going to do adduction out to the side for me. Abduction, bring it back. Internal rotation around, and external rotation back. Very good. You can go ahead and sit, or actually we'll have you just continue to stand. We'll just finish this while you're standing. Let's just check the neck. We're going to check for flexion. So maybe bring your chin down to your chest. So that's good flexion. Now we're going to check for extension. If you could lift your head and look towards the ceiling for me. Good extension. Very good. Relax. I'm going to have you bring your left ear to your left shoulder. Again, checking lateral movement. Very good. And same thing on the right side. Good lateral movement. Okay, that looks good. Okay, now we're going to move to your hips. So I will help hold you, but we're going to first check for extension. So I'm going to have you bring your knee up to extension. Very good. And then put it down, and we're going to have you pull it behind you to check for extension. Very good. Back to the middle. Now we're going to have you pull it to the side for adduction and for abduction. Very good. We're going to have you do external rotation. internal rotation. Very good. And relax that side. We're going to do the same thing on the right. So adduction, abduction. Very good. We also are going to do flexion up. Great. Relax. Extension back. Very good. And then we're going to do external rotation and internal rotation. Very good. Okay. Now, if you can sit, we're going to check your knees. Okay, so coming down, I'm going to check your knees. I'm going to have you extend this leg up, so that's extension, and then flexion down. Very good, and I'm going to help support your leg here. We're going to take this off. Okay, so we're going to do flexion towards your head, bend that ankle, very good. Dorsiflexion towards, plantar flexion towards the ground, very good. And then we're gonna just look at your toes, so just your toes to your head, so that's flexion and plantar flexion down, very good. All right, and then I'm gonna have you push on the gas pedal for me, all right, and pull your foot towards your head, and good strength there as well. We're gonna also have you do inversion towards there, and then eversion towards me. All right, very good. That looks good. Okay, we're gonna do the same thing over here. So extension, very good. Flexion down, and extend one more time. We're gonna rest here. Okay, so we're gonna do flexion towards you, plantar flexion down, very good. Inversion towards me, eversion, very good. And let's just do the toes, so flexion up towards you, and then plantar flexion down, very good. And you're gonna push on the gas, very good. Pull my hand towards you, very good. Good strength there. We're gonna come back up and do the elbows, since we did skip that part since you were standing. I'm gonna have you just flex your elbow in, very good. That's flexion, extension out. We're gonna do supination, so just flat hand up towards the sky. That's supination, and pronation down. Very good. I'm gonna look at this wrist. So we're gonna flex that wrist up, extension down, so all the way down to the ground. Very good. We're gonna do inversion, so keep your hand, very good, and eversion. Good. Let's look at this hand. So this is in flexion right now. This is in extension right now. We're gonna have you flex it, so close your, very good, extend again. Okay, now we're gonna have you just relax. We're gonna have you do adduction, so splay your fingers out, and adduction in. Very good. So you can relax there. I'm gonna do the same thing over here. So go ahead and flex this one up, extend it out. We're gonna do supination towards the sky, pronation towards the ground. We're gonna come over here and check your wrist, so flexion up, extension down, very good. We're gonna do inversion, eversion, very good. And relax the hands, so this is extension. We're gonna have you do flexion, close that fist, extension again, relax, split them out for adduction. In abduction, just relax them in. Very good. So that looks fine there. I'm also going to do some strength tests, so go ahead and grab my fingers and squeeze them tight, tight, tight. Very good. I'm going to have you just put your hands up just like this for me. I'm going to have you pull me towards you. Pull me. Very good. And push me away. Very good. Good strength there. And then go ahead and lift your knee to the sky. Very good. Here as well, knee to the sky. Very good. Okay, everything on your exam looks pretty good. Do you have any questions?
No.
Very good. Thank you.